Hi, I'm Dr. Stephen Lewellis, board-certified integrative dermatologist and founder of Above and Beyond Dermatology. One of the most common skin conditions and really disruptive to a lot of my patients is itchy skin, especially in older adults. In these cases, both the patient is involved, but oftentimes family members or other loved ones are involved as well. This becomes an increasingly difficult problem with age as the skin tends to thin, dry out, and lose elasticity. For years, things like topical steroids have been the go-to for itchy skin, but especially in older adults, these come with some concerning side effects. We need other options. One of the primary issues is the risk of skin thinning and atrophy. If you use topical steroids long-term, especially on aged skin, it tends to become weaker, more fragile, and prone to tearing and bruising. There's also the problem of increased risk of irritation and infections. The weaker the skin barrier gets, the more vulnerable we become to infections and irritants. That's why I'm excited about Dermeleve, a steroid-free option that lasts up to 5 hours and works almost instantly. Unlike topical steroids, Dermeleve is safe for aging, thinning skin, making it a game changer for itchy skin, especially in older adults. For my patients and their loved ones, this means effective relief of itchy skin without the risks posed by steroids. It also means better sleep, better mood, and a better quality of life for everyone involved. And that's not all. Dermeleve is available without a prescription. If you're anything like me, you know all about the hassles involved with prescriptions these days. The fewer we can send, the better. And when you can send someone to a place like Amazon or dermaleve.com to get a great product that can help them almost instantly, that's a game changer for them and a huge value add for you in your practice. If you or a loved one struggles with chronic itch, talk to your dermatologist about a steroid-free option like Dermeleve. My mom actually just bought some for my dad last week and he's excited to get started. For my dermatology colleagues out there, this is a great steroid-sparing option for itch relief because of the triple threat of safety, efficacy, and convenience. Keep this in mind for especially hard to treat things like brachioradial pruritus, notalgia paresthetica. Sometimes patients don't even know this is a real diagnosis, but they are absolutely struggling with it. And if you have something that you're confident has a great chance of working with such a good safety profile, that can be a game changer. I actually like to offer my patients the opportunity to apply the samples right in the exam room while I'm there with them. It can work in as little as 5 minutes. So while I'm talking with them, perhaps wrapping up, they can experience the relief if they're gonna have a good experience with it, and they might even decide to purchase it right there. Imagine the convenience of that and the patient satisfaction. As if that's not enough, Dermeleve offers a risk-free 30-day money-back guarantee. And don't forget, Dermeleve isn't just cream anymore. It's also a scalp serum for those really itchy scalps you come across all the time, especially here in Wisconsin in the dead of winter. To learn more, visit dermaleve.com and listen to episode 43 of the Above and Beyond Dermatology podcast, where I had the pleasure of interviewing fellow board-certified dermatologist, Dr. Daniel Butler. Dr. Butler is a leading expert in geriatric dermatology and itch. He has a passion about bringing unique solutions to this really difficult problem, and we explore some of those in that podcast. Click below to listen.